Hello everybody, this is Dr. William Bay. Just recording this video now for two reasons. One is that a lot of people don't believe that I'm still working as a doctor, but here I am. Let's have a look outside. So this is a real practice. This is real stuff. Everything you see here is real. This is not fake news. And the second reason is I'm just about to be interviewed by Heather from the Australian Doctor Group, so I thought just for my own protection and everybody else's protection, we'll get her on the record to make sure that I'm not gaslit or deceived in the dealings with the mainstream media. Just calling now.
Hello, it's Heather speaking.
Yeah, hi Heather, this is Dr. William Bay from Woody Point Medical Centre. How are you?
Oh, good. Thanks for calling me back. I most appreciate that.
That's okay. Do you have a moment to chat now, or just between patients?
Oh, yeah. Just checking, obviously we've seen the video of your comments at the conference, AHPRA conference, and we're doing a story on it today. So just checking 2 days later or 3 days later, are you worried or concerned about what happened?
Before I go ahead, just wanted to let you know that I'm recording this for my own protection. Do you have any concerns about that, Heather?
No, I'll tape it too, so...
Yeah, okay, cool.
It.
Yeah, so your question was, do I have any concerns about what happened? I have concerns that the profession of medical practice in Australia is not taking the concerns of patients seriously enough. That is my concerns, and that was the purpose of my talk at the AMA conference on Friday, was to try and get doctors to understand how abused, gaslit and harmed they have been by many of my members of the profession.
Now, are you concerned, I mean, obviously the AHPRA is aware and Anne Tonkin was there, are you concerned that there'll be an immediate action hearing?
I'm not concerned that there'll be action, because if AHPRA wishes to censor me for speaking the truth, then they'll show their hand as an agency that's not committed to protecting the interests of the Australian people. Again, what I'm concerned about is doing the right thing by my patients, and I believe that is standing up for their medical freedom, their sovereignty of medical choice, and making sure that they're aware that there are disadvantages and side effects to these mRNA vaccines.
Have you been vaccinated yourself? I mean, I know that's a question that's very personal whether people would answer it, but that will be something other doctors will be interested to know.
So yeah, you've already answered that question for yourself already, and that is that everybody has a right to personal medical privacy, including myself. So that's a discussion between myself and my GP. And I think it's very important that people respect everybody's rights to informed choice on vaccines, and that's what the Queensland People's Protest, the group that I'm leading, is trying to achieve. We're trying to make sure that everybody has freedom of choice about their bodies and their medical sovereignty in Queensland and across Australia.
And what about, because you said you're a GP registrar, what does your supervisor, are they supportive or are they concerned?
I'm really happy to report that my practice here is very supportive of me, and so they should be, because again, I'm doing nothing different other than talking to yourself and people of Queensland and Australia to just get the truth out there about what's happening with this vaccine. So why wouldn't they be supportive of me? It's the people who ran away from me at the conference that need to be worried about repercussions, not me.
Now, your practice offers vaccinations though, doesn't it? Or...
Of course, yeah. Freedom of choice and vaccines and everything is what any practice would be offering.
Yes, so at the moment it's a case of waiting to see what happens with AHPRA and the medical board.
Well, again, I'm not concerned what they wish to do. If they wish to censor me or deregister me or fine me or jail me, then go ahead, because they'll be showing their truth to the Australian community about where they stand in the annals of history. If they choose to let me keep practicing as they already have been doing, and God bless them for that, then good on them. And I will congratulate them and thank them for their humility and their respect in letting doctors be doctors and treat our patients as individuals, not as a public health entity.
So when you say, as they have, have they been aware of your opposition or concerns about COVID vaccines in the past?
Well, I would definitely think so. That protest that I did at the AMA headquarters, the conference on Friday, was my 26th protest this year as the leader of the Queensland People's Protest, and I have repeatedly protested in front of the Chief Health Officer, Dr. John Gerard, at 33 Charlotte Street in Brisbane, saying the same things that I've said on Friday and subsequently. And so I've been quite vocal and outspoken for months now. So if they're not aware of my comments previously, well, they should be by now.
Yes, exactly. I think so. Was there any feedback from AMA attendees?
I haven't received any feedback from AMA specifically. It wasn't my intention to be as loud as I was, I guess, on that day and to interrupt proceedings. I wanted to ask a question and get my message out there politely, but unfortunately, they cut the time off for me and they cut the microphone off for me. So it was an opportunity to get the message out there that my patients are demanding that I get to other doctors around Australia. So I had to do the right thing by the patients. I had to get that message out there. I'm sorry it went down a little bit less professionally than I had hoped for, but at the end of the day, it was a message that was necessarily needed to be broadcast to the doctors of Australia. And I encourage all doctors to join with me in standing up for medical freedom by putting their name down on the growing list on qpp.life/doctors, where I'm collating a list of doctors who are willing to stand with me and stand up for the medical rights of the patients in Australia.
So how many doctors have joined so far?
Well, yesterday it was just me, but today we have 2, and I haven't checked my inbox yet, but hopefully there'll be more. But, it's a choice. Everybody's got a choice. So if they don't wish to stand on what I believe is the right side of history, that'll be on them. If they wish to stand with me, then good on them. And the more that we have, the stronger we become. So I've taken a stand to get my name out there and get my thoughts out there. And I hope other doctors can join with me, because we all learned in medical school that it's absolutely important that patients have choice, that they freely and willingly have the information necessary to make that choice. I haven't forgot those ethics and rules that I learned in medical school. Have you? Have they? I don't know what's going on. I don't believe I'm the silly one. I believe that people have lost their way, and that's why I issued that message at the AMA conference. I'm asking doctors to wake up, honour the ethics we learned in medical school, honour the rules that we're supposed to be abiding by, because the patients are watching you and people are not happy with you.
So initially you didn't go there to plan to sort of be quite so loud. The plan was just to ask a question and hopefully have a debate going,
Yeah, indeed, Heather. I lined up at the side of the conference for about 20 minutes or so. I waited patiently. It's all there on my live stream on the Facebook Queensland People's Protest webpage if you want to check the veracity of that. So I lined up and waited and was very nice about it, but I didn't get that opportunity to be as nice as I wanted to, but that's okay. We've all got to do what we need to do in these trying times. And if Paul Kelly or any other medical officer, any doctor at all, for that matter, wants to challenge me at a reasoned, polite way in intellectual debate, I'm more than happy to do so. I encourage it. In fact, I'd love to get that information out there, because that is exactly what I want to do, which is to stand up for my patients and let the people of Australia have a choice between having or not having these mRNA vaccines.
Okay. Now, at the moment, you're practicing Woody Point, is that right, or do you practice in other places?
Yeah, I'm practicing at Woody Point Medical Centre at this very moment. As I mentioned, it's in a break between patients at the moment. Thank you for giving me the opportunity to add some comment to the article that you're going to be running today or tomorrow. I will continue to keep practicing and serving the people of Queensland until, or if AHPRA decide to stop me. But if they do, bring it on, because I'm not going to back down, because I believe that I am serving my patients by speaking out like this, and that is exactly what my patients are telling me. They're saying thank you, thank you, thank you.
So had you been involved in the vaccination program? Were you doing vaccinations before patients started coming in complaining of adverse events?
100%, yes, that's right. I was doing vaccines and a number of them at Strathpine 7-Day Medical Centre, where I worked at that last year. That's right, Heather, yeah.
And, sorry, it's my writing catching up there. Now, there was also a video that shared on social media where it looks like it was that immediately after you got taken out of the conference, where you said that you had thrown away your medical licence in front of Paul Kelly, or was that a different event?
No, that was me coming across a protest synchronistically that happened to be running just a few minutes after that AMA conference in a park near the conference in Darling Harbour, so I took the opportunity to stop and say a few words because, I thought it was important to get, again, this message out there that these vaccines are causing harm and not enough doctors are talking about that. When I said I threw away my license, I said that because that's probably what's going to happen, isn't it? I mean, I would be surprised if they don't, but if they do so, they will be recorded in history as the organisation that would not let doctors speak, that would not let people like me give the minority report, let doctors say that the emperor has no clothes. So again, if AHPRA wants to disable my practice, go ahead. I welcome it. It's fine. But I don't want them to, but if they need to, then that's what they will do.
So just quickly, what year are you in the GP program, training program?
I'm a second year, GPT2.
And you mentioned, I think it was the half-time chat about some patients had died. Do you know how many of your patients have died from, or you think may have died from the vaccine?
Well, knowing and thinking two different things. I don't know specifically, and that is because, as you may be aware, the medical boards via AHPRA does not allow the freedom of speech to discuss these type of things. That's exactly why you're calling me now, because I'm in danger, like many other doctors who've been censored before, for speaking out these things. So I would love to have the data to know exactly how many of my patients have died, have been harmed. I mean, we've got, 200,000 reports to the TGA of adverse events. We've got close to 1,000 deaths reported. So these are just the reported ones. Have there been full investigations on that? No. There's been no autopsies to my mind. Senator Rennick has been trying to get this information out there, but we just can't get it. So that's why it's really important, I believe, what I'm doing, because if I can make it easier for doctors to speak out, then we're all going to get this information and we can find out finally once and for all what is happening with these mRNA vaccines.
So I take it you made reports to the TGA on behalf of your patients since they got turned away from emergency departments?
No. Initially, I did not make any of those reports because I was afraid, as many doctors are, because as soon as you get caught up in criticising the mRNA vaccines, then all this fear and pressure from our colleagues and from the college and from AHPRA and everybody starts coming down on you. So I made recommendation in my notes, but did I go ahead and have the guts to report it to the TGA? No, I did not, because that was back in the day when I valued my job and my family and my security and my finances more than my patients. And I apologize for that, and I'm sorry for that, and that's what I'm trying to do now, is to make up for my past mistakes by honouring the medical ethics that I ascribe to, which is helping the patients first.
Well, thank you there. Now, you've made a lot of valid points, so my editor might want to just do a sort of write and reply. This story we'll just do very straight, saying, what you said at the conference and afterwards on the half-time speech. So,
yeah. Not a worry.
It might be better to run a separate story tomorrow saying, why I did it and why I'm not regretting understanding it for my patients. But I'll send you a quick email if you like and just let you know what we're going to do and just want to make sure you have a chance to have your say. Yeah, no,
and thank you for giving me the opportunity to have a say, Heather. Again, I just want to mention that I've recorded what we've had to say, and I will be publishing this on our Queensland People's Protest website, qpp.life, everybody. So thanks again, Australian Doctor Magazine and Group. I've always enjoyed reading your work, and I will continue to do so.
Okay, thank you very much, Dr. Bay.
Okay, see you, Heather. Bye.
Thanks, bye.